This treatment plan is the recommendation of Dr. Gary Glassman. Kerr Endodontics is a medical device manufacturer and does not dispense medical advice. Clinicians should use their own judgment in treating their patients.
I've decided, based on the fact that the number 15 file fits snug at working length in the MB canal and fits relatively loose in the DB canal and the palatal canal, I'm going to use the SM series in the mesiobuccal canal and the ML series in the distal and palatal canal. So first, the mesiobuccal canal, the SM1. Place that in the handpiece at working length. Make sure that the pulp chamber is brimful with full-strength sodium hypochlorite, and we dip our files in the viscous chelator, whether it's slick gel or RC prep. Make sure the file's rotating before you enter the canal. And when you enter the canal, as soon as you meet resistance, you'll start feeling a little clicking motion. That clicking motion is when that file starts to reciprocate. As soon as you feel that, advance another millimeter or two and then retrieve your file. Quite often in very tight canals, very calcifying canals, it may take 1, 2, or 3 passes to get to the working length. But the trick is not to force it, but to let that file work its way and follow the glide path that you previously created. Once the SM1 gets to working length, then we go to the SM2. SM2 is set at working length. That's the single color band yellow. That's an 0.6 taper, 25 tip size. Dip it in the slick gel. But before we do that, in between each file size, we may want to establish and maintain apical patency to prevent the accumulation of dent and debris. Then we take our SM2, activate it, have it rotating before we go into the canal. When it engages, advance another millimeter or two, and then come out of the canal. Wipe off the debris. Re-enter that canal until it meets resistance. Wipe off the debris. And you continue this in short motions until you reach the working length. Understand that each file that we use needs to go to working length. Making sure that we fill up our pulp chamber with full-strength sodium hypochlorite, and in between each file size, reestablish and maintain apical patency, where the 0.8 hand file goes 0.25 millimeters to 1 millimeter past the apical constriction to prevent the accumulation of dent and debris. The last file in sequence, if we want to apically prepare, is the SM3, the single color band red. It's an 0.4 taper, 35 tip size. Once again, make sure we have fresh sodium hypochlorite in the pulp chamber. Use our slick gel or RC prep and place it in the canal while it's rotating until it meets resistance. Remove it from the canal, wipe off the debris, and you repeat this and continue until you get to working length. And that's the way we treat the small canals where our 15 file struggles to get to the working length. Each file in sequence of the TF adaptive, we work in increments until we reach working length. And we don't proceed to the next file in sequence until the previous file has actually reached working length. For those canals where the number 15 file fits loose at working length, we'll go straight to the ML series, which will probably account for over 90% of the canals that you treat in practice. So once we finish creating our glide path, the first file we're going to use is the ML1. The ML1 is a double color band green. It's an 0.8 taper, 25 tip size. Some doctors prefer to use this one file as their shaping file and keep the apical area as small as possible. Place that into the handpiece. Make sure we dip that in slick gel. Our pulp chamber is brimful with sodium hypochlorite. Have it rotating while we enter the canal. And as we meet resistance, advance another millimeter or two and then retrieve the file. Wipe off the debris. Continue this process until you reach the working length. it's quite permissible and maybe advantageous on the retrieval of the TF file to actually use it in a brushing manner, especially useful in cases of ovoid canals or cases that you want to open up the coronal third a little bit more. So when you go down on the retrieval stroke, orient that and guide that away from the furcation towards the safe, bulky areas of the canals. Good? Okay. And we can now go into the palatal route. Larger canals sometimes only require 1 or 2 passes. Make sure that you achieve apical patency. And then we go to the ML2. The ML2 is an 0.6 taper, 35 tip size. It's a great instrument for apically preparing. Once again, fill up the pulp chamber with fresh hypochlorite. Dip your file in slick gel. Enter the canal that was already prepared by the ML1. Wipe off the debris and do it in small increments until we reach working length. Do that in the palatal canal. Now, if my ML2, the 0.6 taper 35, engages dentin at the apical 1/3, then I'll deem to have finished that root canal. But in palatal roots of upper molars, distal roots of lower molars, sometimes that ML2 fits loose at working length. And I may want to apically prepare it even more by using the ML3. The ML3, double color band red, is an 0.4 taper with a 50 tip size. Smaller taper than the ML1 and the ML2, but a larger tip size. Perfect for engaging the apical 1/3, the palatal roots of upper molars, distal roots of lower molars. We've apically prepared the mesiobuccal. We've apically prepared the distal buccal. And now we're going to apically prepare the palatal canal. Coat it with slick gel, have it rotating, and quite often all it takes is 1 pass to get to working length to apically prepare, as that engages dentin at the apical 1/3. Once we've completed shaping of the root canals with our nickel titanium system, our TF adaptive, now we can move on to final irrigation protocol. Protocol.